Hello, my name is Drew Prosser, and I'm the Chief of Peds ENT as well as the Residency Program Director here at the Medical College of Georgia Augusta University program. I'm going to talk to you a little bit today about our division and section of pediatric otolaryngology, specifically as it relates to resident training. We actually have a long history of care for children in the Augusta area. Actually, the first children's hospital in the South was in Augusta, and actually was on a site that's not too far from here where our current Ronald McDonald House is. But it was called the Willenford Hospital for Children. It was started by a group of dedicated Augusta women after a donation from the wife of a wealthy New York banker named Grace Shaw Duff. She donated $26,000 for construction of the hospital and equipment. So it went a long way back then, and it opened its doors in 1910. This is actually the cornerstone of the children's hospital, which is displayed in our current children's hospital. This is a picture of the building, again, which sat on the site where are very close to the site where our current Ronald McDonald House is, but it was torn down in the 50s after it was deemed a fire hazard, and we've of course come a long way since then. Our current children's hospital in the background, I believe this was 2 years ago, ranked #1 in the nation in quality and safety out of all children's hospitals in the U.S. These are the members of our division. So Dr. Heather Kane joined us. There's me, Brian and Crystal are our two nurse practitioners who are amazing, and we'll talk about it a little bit. Dr. Kane did her residency training at UVA and fellowship at Vanderbilt. She subspecializes in pediatric facial plastic surgery, including cleft lip and palate, mandibular distraction, VPI, vascular anomalies, and voice and swallowing disorders. There's one of the things that is a huge benefit of our program is we really do have a great relationship with pediatric plastic surgery here. There's no plastic surgery training program, so our residents cover Dr. Yu and Dr. Lima, who are the two pediatric plastic surgeons, and collaborate frequently, most frequently in our craniofacial clinic, but for other conditions as well. And it really rounds out and adds to y'all's experience here. This is me. I trained here at MCG, did fellowship at Cincinnati, and kind of subspecialize in airway reconstruction, head and neck, sleep OSA, and sinusitis. Again, we have a really good relationship with Peds Pulmonary, and we do multiple multidisciplinary clinics, which really attracts tough cases, which is great for a training environment. So what do we do? So yes, we do everything Peds Oto. We have a local, regional, and national referral base. We have a good mix of bread and butter and complex cases. And again, I alluded to this earlier, we have a lot of multi-specialty clinics. We have air digestive clinic, trach vent clinic, complex sleep clinic for children who still have persistent sleep apnea after adenotonsillectomy. We have a very active CF center, and because of that, do a little bit more pediatric sinus surgery than most places, which is a nice skill to have. And again, are active members of our cleft and craniofacial team. Just some pre and post cleft lip and palate and craniosynostosis cases, tumors and microtia, and a variety of endoscopic and open airway procedures. So really, why should you come here to train in pediatric otolaryngology? Well, we're a growing division. We're pretty much always recruiting, but we'll hope to add a third pediatric otolaryngologist in the next year or so. We've hired an additional pediatric audiologist. We're We're the busiest surgical service at the Children's Hospital, and have an amazing relationship with the pediatric hospitalist team who admits all of our patients. And this really allows you to focus on really what you should be learning as a resident. So if that tonsillectomy patient who's on the floor needs adjustment of their Tylenol dose, the nurse is paging the pediatric hospitalist team to help update those orders and do that so that you can really focus on surgery and the things you're doing. And again, we talked about it earlier. Our nurse practitioners truly are amazing. They really are the wheels that keep things running. The picture down below. So this is actually right outside my office. One of the things that I think speaks to how good the experience is in Peds and pediatric otolaryngology is here is really the number of residents we've had go on to pursue pediatric otolaryngology. We're really a mid-sized to small residency program, and have had really a number of people pursue pediatric fellowships and are practicing at multiple academic institutions across the country. Many of these pictures on the wall, I bet you will recognize from your medical schools. And because of kind of how busy we are, we've a little bit outgrown our current Children's Hospital footprint. This is a architect's rendering of a $75 million expansion to our current Children's Hospital, mainly to expand our ICU care for our neonatal and pediatric ICUs, which should be coming in the next few years. Just to look at the kind of proposed lobby and some waiting rooms outside of the floor rooms. Thank you again for your interest in our program. And again, if you have any questions about pediatric otolaryngology or the program in general, please don't hesitate to shoot me an email and I'll get back to you.